Hi, it's Rosie with discussion for post questions, and I'm going to go right into question one. I do agree that interpersonal group therapy is a social microcosm, and it is good for improving recovery outcomes. Why? Because it's a community of people. They have the same kind of struggles, right? Different addictions, dealing with their struggles. They come together and they can remind each other of significant people in the past or in the present. They begin to deal with different feelings, different ideas. Each member in that group has, they build the courage eventually to be able to address meaningful things and difficulties that has happened in their lives, such as Jimmy and how Jimmy disclosed throughout this in the video towards the end. Some of the benefits of having interpersonal group therapy is having a positive peer support, being able to have accountability, to abstain and refrain from substance abuse. Also, I do believe that people are and it enables people to be able to see those who have successfully completed group. It also gives people useful information, especially if they're new to the group. And it does offer a family like experience. Again, it's about relationships, it's about dealing with relationships and changing and um, addressing difficulties, right? So they begin to build, they begin to team. And so those are some amazing benefits that happens with that. Also, just with processing content, I do believe that I am a content person all day long. I like structure, I like order. I like to be able to say, hey, this is what's going to happen, step one through whatever. And this is when I believe that the goals can be attainable. And so processing, I think processing works throughout anything you do. You have to be able to process. And I think Layden's description of processing over content, um, his description, he kind of got it like gave it in a dialogue, just saying, okay, basically, content is the dialogue or what we're talking about, and the process is the manner of bringing the material to the group, such as Sabina. So Sabina, her content was the alcoholism, right? Dealing with the alcohol addiction. But the material that she brought to the group, which was her husband and how she discussed her husband, that was the process of it all. And depending on how you bring that process to the group may receive it or they may not. And so she just didn't want to really address the maladaptive behaviors that she was having as far as drinking, but she was quick to really disclose what her husband was doing. And even when they tried to offer her advice, she really didn't want to hear it and she wasn't open to receive it. So in that sense, she wasn't really ready, in my opinion. Just vulnerability. Vulnerability is so important in groups. And Jamie, he disclosed his vulnerabilities when he began to discuss stealing the medication from his mother. And for me, I really didn't have any kind of feeling about it, but I was like, okay, well, good. Now that you have actually opened up and talked about what you did, now you can move on. I believe that probably was something that kind of held him back from being able to move forward in being recovered from his addiction. I believe that that was probably a secret that he held for a long time. So to be able to discuss that in that setting, he just really gave the most vulnerable part of himself. And the way the group responded to him, I thought it was just really great. It solidified the trust that he had with them. And I believe the way that Jax handled, the response and asking questions and follow-up questions through the disclosure and the meta disclosure, I thought it was really great because it gave him the opportunity to, share that now I trust this group. Now, the feeling I felt like I was going to be judged or disrespected, or no one would respect me as a person because of the action that I took. And to see someone else be open and disclose their vulnerabilities, it gave me the courage to do it for myself when he talked about Gemma. I think that was really good. But on the other hand, going into different sessions, him talk, Brian, and the way the group responded to Brian, I think they were really, they were really judgmental. I mean, it just seemed like, Brian really was kind of nonchalant about his response and how he disclosed his actions with domestic violence, but that was probably the best way he can get it out. And unfortunately, the group didn't receive it that way. Um, for me, I feel like as the clinical therapist, I probably would have gave him that same disclosure um, that Jax gave to Jimmy, and would have asked him questions to really kind of dig a little deeper to get him to disclose a little more why he felt the way he felt. Like, okay, everybody goes through things. Okay, well, why do everybody go through things? What did you do that, what kind of things were you going through basically to get you to that place or that point to where these actions took? And, gives him that sense of being able to take accountability. Now he can disclose more. I just feel like I would have taken that approach as opposed to allowing the group to just really, in my opinion, kind of get a little out of control because, now everybody's frustrated and now it's name calling and it's blame and it's judging as opposed to really sticking to the focus of the group. For me, I just would have handled it a little differently. But unfortunately, that ended Brian's group therapy with them because he never came back. And then just with the rituals, I thought Jimmy's his farewell speech or his ending speech was really great because it gave him an opportunity to have closure. He was transitioning from going through this rigorous group therapy. He just really grew, and now he's going into another less intensive treatment to where he can continue to grow. So it's important for him to go empowered and strengthened and being able to leave on a higher note so that it opens the door for him to be more successful when he goes into the next phase of his life. And also it gives those who lost hope or those who didn't think it was attainable to be able to see the whole process with him and to transition. So it kind of gives them hope as well too. So I really believe that having a celebratory ritual or a ceremony or commencement, I really think it's important. An example I would use is even our cohort in commencement, graduation. We've sacrificed 2 years of our time, dedication, tears to earn a degree in our master's program. And what better way to celebrate it than a commencement? That is a transition that we are leaving from something that we were so fearful in overcoming to now we've mastered it. So now that we've mastered it, we can go out into the world with this confidence, with this strength that I did it, so can you. And so I think that anything you do, we ought to celebrate. I think we ought to, give some type of acknowledgement about it. I really do, especially in these days and time. How can our clients benefit in recovery? So benefits in these type of rituals in recovery, I think it's strength-based, it's empowering. Our clients will go out feeling like, hey, I did it. I can conquer the world. Even just going through a biblical perspective, I can do all things through Christ who strengthened me. I went through this program, so now I'm transitioning to, oh my God, can I do it? To I did it, and I did it, with the help of my group members, taking accountability, building those relationships, establishing trust within the microcosm. So that is my discussion post questions and answers. I hope you guys enjoyed this video and have a good evening.